Hey guys.
Hi everyone.
Today we're going to do a quick live on fact versus hype on the coronavirus that's been going around. So we've just recently put an article up on our website, guys. Jump on and have a look. And it's really cool because you can read through some of the things that we're about to talk about right now. So we know that 2019, Wuhan, China, this virus seems to have originated from there. But we're going to talk about a couple little things about stuff that you need to know. So the first thing is how long, if you got the virus, how would you know you had it? How long would it actually take?
What we're talking about here is the incubation period. So from when you are first exposed to the virus to when you first start seeing symptoms, the average incubation time is 5 to 6 days, but this is the average. So we know that it can range anywhere from 1 day to 14 days from your exposure to the virus initially.
Right. And the symptoms, they're all over the place. You can read about that too on our website. We're not here to talk about that now. We're here to talk about a couple of other things. We're going to talk about how infectious is the virus. So then, in the literature, I've got a number here called the R0, and that means from one person, on average, how many other people would catch it from that one person. And the studies that are done so far, the WHO, World Health Organization, actually estimates this one to be somewhere between 1.4 to 2.5. In some regions, 2.79. In other regions, it's as little as low as 0.4. Okay, so that sort of puts things in perspective. There's still some research being done on this now.
Yeah, and so what does this mean when we talk about obviously how infectious it is? How does that then relate into the severity of it when we compare it to other infectious diseases, Dr. Jeremy?
Yeah, great. So to put things in perspective, this is what we've really got to do. We've really got to compare then how easily does this one transfer versus other viruses that have been around, and then how common is it that it's going to really hurt us or affect us. So what ends?
Really commonly, let's just start off with one that a lot of you would know. So if we talk about the measles infection, so in terms of the R0, so how commonly or how on average, how many people would be infected if one person had it? What was the number?
Yeah, so I think that the measles is really interesting. That one is on our website too, guys. You can have a look at that. That's 12 to 18
people
of the R0. So if you've got one person with measles, we know that's can contract pretty well, 12 to 18. This one's a lot less than that.
Yeah.
So that out of the way, but you just mentioned
the severity,
about the severity, and that's called the case fatality rate, CFR, and you can look that up on our website as well. It's just on the tab on the far right hand corner. You'll find all this information. But this one, we know that the case fatality rate really is, well, what percentage of people will actually pass away if they have this virus, and where this around where it originated is 2.9%. So again, they're not really sure about this, and this is being studied more and more. And they think it's probably been underreported because a lot of people probably have this infection, this virus, that didn't even know they had the infection.
Yeah, and that's the reason being is because 80% of cases, people that have the coronavirus, 80% of cases are actually quite mild. So a lot of people would have the infection and not actually report it. So this case fatality rate may actually be a lot lower than what we're seeing here in this statistic.
That's correct. Case fatality rate probably is a lot lower because of the people that haven't reported that they've had the infection.
Yeah,
spot on. So based on current data, 80% of people are going to be fine if they catch this infection. So we just want everyone to know that, especially if you're nice and healthy and got a strong immune system. 20% may require some hospitalisation, and then even lower than that, 3 to 5% may require intensive care. And that's really based on some things about your own health, and that's where we can have control in this situation, guys. So we want to boost our own immune system up. The people that really need to be worried, Ange?
Well, these are the people that have the immune or compromises to their immune system. So we're looking at the elderly population, but really people that have like your hypertension, diabetes, or other cardiovascular diseases as well. So people within that population are more likely to be affected by the coronavirus. And still, for those people as well that do have the more suppressed immune systems, we're still here helping them as well because we want to boost up their immune systems as much as possible.
There's lots of tips and things that we are helping you manage that with, which is your exercise, your sleeping, there's some nutrition, and lots of other things that you guys can do to keep your immune system nice and strong. One thing I just want to mention really quick, and it's on this research too, is that we've had coronavirus 2 other times transferred from animals. Most people don't know that. So when I say the names, you'll probably recognise them. SARS, so that one was 2002. And then we've had the Middle Eastern Respiratory Syndrome coronavirus, which is the MERS, and that one was 2012. Now on these ones, if you have a look and do the statistics on those, the case fatality rate of SARS was 10% worse than what this one is, and the MERS is 40% worse than what this one is. So the world has had this stuff before, and in fact the research at the moment is showing that they are actually more severe than this one. So we just want people to know that if you're immune compromised, that's when you've got to be really, really careful with this. And yes, we don't want to spread this because it can get to immune compromised people easier. That's why we've got to do all the sensible things that are listed on our website, and we'll do some more lives about the symptoms and what you can do to also slow down the spread of this virus, so we do protect the vulnerable people in our community. But rest assured, if you're really healthy and strong, you guys, we're all going to be okay. And it's the people that have an immune issue that we just need to protect right now.
Yeah, and so again, the world has experienced this before, so we've just got to, again, not go crazy and buy too much toilet paper or all the things in the shops, because we have experienced this, and the way that the government is going through things at the moment is to protect our hospital system so that they aren't inundated with people. So we just need to keep doing what we are doing and following the guidelines that the government has shown, and like Dr. Jeremy said, we will be doing more lives as well.
Beautiful, guys. And those stats I just went through, I just realised I made a mistake. The infection 1.4 to 2.5 of R0, I said 0.4. That's the severity in some provinces. That was the case fatality rate was 0.4. But the R0, just check it on our website, 1.4 to 2.5 can be a bit higher based on some studies, and the severity of the case fatality rate is as low as 0.4 up to 2.9. Check it all out. We've got on there compared to other viruses and diseases that have been around. Really good to just put things into perspective and have a look where this particular infection fits in on the grand scale of things of other infections that the world has already experienced. Have an awesome day, guys.
No worries. Thanks, guys. Bye.
See you later.